Monkeypox is a rare viral disease that belongs to the same family of viruses as smallpox. It was first identified in laboratory monkeys in 1958, hence the name monkeypox. However, the first human case was recorded in 1970 in the Democratic Republic of Congo. Unlike smallpox, which has been eradicated, monkeypox still occurs sporadically, primarily in Central and West Africa. Monkeypox is primarily transmitted to humans from animals, particularly rodents, and primates through direct contact with the blood, bodily fluids, or skin lesions of infected animals. Human-to-human transmission can also occur through respiratory droplets, physical contact, or contact with contaminated objects. The virus can enter the body through broken skin, the respiratory tract, or the mucous membranes of the eyes, nose, or mouth. The symptoms of monkeypox are similar to those of smallpox, but generally milder. They include fever, headache, muscle aches, backache, swollen lymph nodes, chills, and exhaustion. Within a few days after the fever begins, a rash typically develops, starting on the face and spreading to other parts of the body. The rash progresses through several stages, eventually forming scabs that later fall off. The monkeypox rash usually begins as flat, red spots on the skin, which then turn into raised bumps. These bumps fill with clear fluid, then pus, before forming crusts and eventually falling off. The entire process usually takes about 2 to 4 weeks. The presence of these lesions is a key indicator of monkeypox infection, and they are highly contagious during this phase. Diagnosing monkeypox involves laboratory testing of samples from the rash or blood to detect the virus. There's no specific treatment for monkeypox. Care is mostly supportive, addressing symptoms like fever and pain. In some cases, antiviral medications may be used. Vaccination against smallpox is about 85% effective in preventing monkeypox, which is why it is sometimes recommended for people exposed to the virus. While monkeypox is usually self-limiting, meaning it resolves on its own, some individuals may experience complications. These can include secondary infections, bronchopneumonia, sepsis, encephalitis, and corneal infection, which can lead to loss of vision. The severity of the disease can vary depending on the strain of the virus, the individual's health, and access to medical care. Monkeypox outbreaks are relatively rare but have been increasing in frequency. These outbreaks are typically small, involving fewer than 100 cases, but they can cause significant concern due to the potential for human-to-human transmission. The majority of cases have been reported in Central and West Africa, though isolated cases have been reported in other regions due to travel or importation of animals. Preventing monkeypox involves reducing the risk of animal-to-human transmission by avoiding contact with wild animals and practicing good hygiene. In regions where monkeypox is more common, it is advised to cook all animal products thoroughly before consumption. For human-to-human transmission, isolation of infected individuals and the use of personal protective equipment, PPE, can help prevent the spread. The smallpox vaccine has been found to offer protection against monkeypox. Although routine smallpox vaccination stopped after the eradication of smallpox, people who were vaccinated decades ago may still have some level of immunity. In the case of an outbreak, vaccination can be administered to those at risk to help control the spread of the virus. Global health organizations are monitoring monkeypox outbreaks closely, with ongoing research into better diagnostics, treatments, and vaccines. Enhanced surveillance, particularly in endemic regions, is crucial for early detection and containment. Collaborative efforts are also underway to understand the virus better and to prevent its spread beyond endemic areas. Monkeypox is a disease with a low fatality rate but significant health impacts. Public awareness, preventive measures, and prompt medical attention can help manage and control outbreaks. As we continue to monitor and research monkeypox, it's essential to stay informed and take necessary precautions, especially in regions where the virus is more prevalent. If you live in or plan to travel to areas where monkeypox is known to occur, it's important to take preventive steps such as avoiding contact with wild animals and practicing good hygiene. Stay informed through reliable sources and consult healthcare professionals if you suspect exposure to the virus. Together, we can work towards minimizing the impact of monkeypox on global health.